million Americans who suffer from back pain. You do not want to miss this. A chiropractor has come up with a way that you can help ease your pain without actually having to go to the office. Take a look at this. It's called the True Align Body System, developed by a chiropractor and her husband. They say by spending just 20 minutes a day, you can improve your alignment and relieve pain. And we have that chiropractor here this morning. Evelyn Zulke Hayworth and her husband, Kelly Hayworth, are here to talk about it. Good morning.
Good morning.
And welcome. This is your baby, and it's very easy to use. And you said just 20 minutes a day.
Yes.
And it helps with alignment. How does it work?
Well, gravity actually exerts a downward pressure as you're placed at on these cushions at key points. You lay on it face down, and it realigns the jaw joint, neck, upper back, mid back, lower back, sacroiliac, brings the shoulders back. Of course, the main reason that people are motivated to use our system is to relieve pain.
And to relieve pain, and then hopefully kind of avoid having to go to a chiropractor in the first place. Constantly. Yeah, eventually. And Kelly, you are
the man behind
the man behind it. And when your wife came to you and said, I have an idea, I really want to do this, were you on board right away? How has this process been?
I was on board right away, but I did something stupid, and I told her, you're going about it all wrong. And boy, did I get the look. And then I said, because she was trying to put it and cushion and see how it felt, and I said, you need a dummy. And that's my wheelhouse. And
that's your wheelhouse. And you're going to demonstrate for us, so why don't you hop on it, Kelly?
More than happy to. Very simple to get on.
Okay, so you get on like that.
Right, and so what I'm going to do is I'm going to put just below my abdomen, goes right on the front.
Okay.
So I just cantilever myself over.
By putting it on that pivot point, it doesn't matter how your pelvis is misaligned.
Okay.
Whether it's this way, it doesn't matter, because at that pivot point, it's going to bring it to the neutral position.
Very good. So once he's down there, does he have to do anything, or he just has to lay in this
Just
position?
has to lay there.
Oh, so gravity does the work.
Oh yes, gravity is exerting a downward pressure. Unfortunately, in our modern society, we're doing everything here. We're not doing a lot this way. So this helps to restore the normal curves, the side view, and then surprisingly, we also noticed that, and we found out there was a study done not that long ago that showed when you restore the normal neck curve, that it also alleviates idiopathic scoliosis. So it helps the curves from the back as well as from the sides.
And this has been out for less than a year.
Less than a year.
After 3 years of working on it, you say you go to a lot of trade shows, and what kind of reaction have you been getting from people who see it?
We let them try it for 10 minutes. We actually do some measurements, and even in 10 minutes, we see some height increase because of the decompression effect.
Oh.
We see the pelvis align, at least temporarily. Now, eventually, from repeated use, that would become permanent.
Right.
Once you've achieved your perfect spine and you get super limber, it's amazing. Because the end points of the muscle eventually also get realigned where there's some fibrotic tissue, and that loosens that up as it's decompressing and reshaping.
And so you lay like this 20 minutes
That's right.
every day.
Yes.
And then you will feel like a new man. So is it comfortable to be laying in this position?
I love it. I love it. On occasion, it might be a little uncomfortable, but not very often. Usually, I feel like I want to fall asleep on it. And people who do yoga and meditation, they say, oh, wow, I feel the dopamine rush.
Yeah, definitely. And I like that nobody has to do anything. Because, you know, you almost feel like you have to, like, be popping something, but just gravity does all the work.
Things do pop.
Things do pop. Just naturally.
Yeah, just naturally.
In a good way. Thank you so much for coming on.
We started with Linnea and the True Align Body System. So, Linnea, how do you feel now?
I instantly felt taller. I felt really light, and I can still feel this floaty feeling. My spine feels longer, and there's just more space. I have more range of motion in my neck, which has been really tight in the past.
Sounds like it did a nice stretch.
Come on, look at this.
There we go.
Does that feel better? All right.
Very graceful. And Dr. Human Melomed's here. He is an orthopedic spine surgeon. We wanted him to weigh in because this is clearly an at-home treatment designed to be used for about 20 minutes. You know, who might benefit from this type of thing? Can something like this help people feel better? What's your opinion?
I think absolutely. I mean, I think it's a pretty cool, innovative, alignment apparatus. I think people in their 20s, 30s, 40s, and 50s, maybe even early 60s, people who are working all day, like standing or especially sitting, I think it's a pretty cool thing to go kind of let your body stretch out. The great news about it is that it's not something that's irreversible. If you're on it, if it hurts, if it's not comfortable, you make adjustment. If it doesn't work, you get off, basically.
So it sounds like something we talk about a lot, which is for pretty much otherwise healthy people, something like this may be of benefit.
Absolutely.
And clearly, we have a happy customer in Linnea,
absolutely.
so
Hi, I'm Yvonne. I'm actually a patient of Evelyn's. Back in 2009, I had a slip and fall on a patch of ice that caused me to have back surgery, 2 knee surgeries. I had to have a cage put in between my 4 and 5, and I also had to have rods put in to keep the 4 and 5 stationary. When I came to Evelyn, I would come actually 3 times a week to be adjusted. When she created this special, at that time I called it my mini Evelyn, and I began to use it. It was so comfortable that I could sometimes fall asleep on it all night. But what I noticed was I began to not have to come to her as often because I would already be getting aligned every night. It's caused me to be able to be back to the gym doing Zumba and swimming. Sometimes I swim 20 laps nonstop. It allowed me to be able to go back to teaching school and not be in so much pain. I know that the Kacelia, which I still call the mini Evelyn, has really changed my life. And I don't see myself needing or having to do another fusion as a result of the first fusion that I have, which a lot of patients have to do. Thank you.
Thank you for choosing the Kacelia True Align Body System on your path to better health and vitality. This tutorial video will assist you in setting up your new system. First of all, people who are sensitive to that new car smell will want to remove the mat, unroll it, and air it out before use. Place the mat on the floor or your therapy table. Place the headrest centered near the top. The headrest comes preset to medium, but can be adjusted by lifting the arms up and securing them back down evenly. Position both shoulder supports with the top edges close to the bottom edges of the headrest and angle the bottoms outward. Locate your ASISs, the anterior superior iliac spines. These can be found by putting your hands on your hips like Simon says. The bony bumps that you feel under your middle fingertips are the ASISs. You can measure from the base of the throat to an ASIS, or guess that length and place the pelvic support, centered, that length from the bottom edge of the headrest. Make sure that the front flat edge of the pelvic support faces the headrest. A medium-sized person would place one riser under the pelvic support, and a large person would use 2 risers. Our smaller size model requires none. Place the ankle roll centered near the bottom of the mat. Kneel in front of the pelvic support, staying close and centered, and lower yourself down and forward, aiming to land the ASISs at the front edge of the pelvic support. Shift both shoulder supports evenly so that a small corner of each piece peeks out above the shoulder. Move the headrest forward or back so that the eyes are located at the indentations. The forehead should be supported at the top, and both cheeks in front of the jaw joints are resting points. It's normal to feel like it makes the mouth want to relax open a little. Make any adjustments of the ankle roll with your shins. Stretch your legs out straight and then bring the knees down. Make any needed fine-tuning to the pieces and bring the hands down to the sides evenly and relax. Some people prefer to have their hands up near the headrest when they first start their treatments. Feel free to make any adjustments at any time during the therapy. Some people like to mark the placements of the supports with stickers after the first treatment for easy future setup. Place the stickers at the end of the orange piping of the shoulder and pelvic pieces, and one at the top center of the headrest. It is recommended to leave the TrueAlign setup ready for use. When there is limited space, the support pieces can be pushed up to the headrest, and the mat can be draped forward over the pieces. If you have lost any height, please measure yourself first thing in the morning before starting your therapy, and re-measure every 2 months. Like so many things in life that are worth doing, getting the most out of your treatments requires carry-through. Please make the commitment to spend at least 20 minutes a day on your TrueAlign. Once you have achieved the new vital you, the frequency may be cut back. Thank you again for choosing the Kacelia TrueAlign body system.